This week's Mental Wellness Wednesday topic is military families' mental health.
What are some of the mental health struggles veterans and military personnel deal with?
Some common issues that I see in outpatient with veterans is a lot of PTSD, a lot of anxiety, and I do see a lot of substance abuse, whether it's alcohol or whether it's recreational drug use. You see more of the alcohol than you do recreational drug use, at least from my standpoint. And I think the reason why you see a lot of these symptoms is because PTSD is varying for everyone. So I think the primary thing that when you say PTSD, the general public thinks, they're a combat veteran where, they were involved in these hand-to-hand combat sort of situations where, lives were lost and these huge, traumas were witnessed. But that's not the case all the time. PTSD, trauma is anything that you experience that causes you to have a change in your everyday functioning, So if, say for instance, a soldier was overseas and they had to do the night shift call. So they're in the watchtowers at night, maybe that being so hypervigilant of having to look out for their soldiers makes them not be able to sleep as well. So that's still traumatic and causes them to have issues when they get back home. But it's not what you would typically see. So a lot of times a soldier has a hard time, relating their symptoms as PTSD because it's seen as only these varying extremes of what PTSD could be. And then, as far as the anxiety, that goes, hand in hand with PTSD as well. When you're not sure of what's going to happen, especially a lot of veterans that are out of service, they're no longer in service. They're used to a structured routine, everything sort of saying, do this, do this, do this. When they're put on their own into the everyday life, everyday world, they don't have that structure as much. So they're sort of worried about what's going to happen. What if I don't do this? What if I don't do that? That's where some of the anxiety comes into play there. And then, with substance abuse, that's the easiest thing to access, especially alcoholism. It's very cheap. And a lot of soldiers, going on to what Mary mentioned earlier, they feel stigmatized. So a lot of times they try to treat themselves and alcohol works as a CNS depressant. So it pulls them down so they don't have to actually think about those stressors or think about the trauma they were exposed to. But the problem is once the alcohol's out your system, the stressors are still there. So they don't really have a good effective treatment for those symptoms. So that's how I see a lot of veterans presenting to me here in outpatient. What about you, Mary?
Just to add on that, it's true. The veterans, all the active duty, there is that feeling. The loneliness, sometimes the anger issues when they are not, they feel as if nobody, whatever they went through or whatever they are going through, if whether there is anybody who is really understanding and relating to those issues. And so whether it is depression, feeling lonely, anger outbursts, where the relationships within the family, whether it is with the children or with the spouses, I've seen that a lot being affected, the relationship being affected because someone is feeling as if nobody is understanding them. Mm-hmm. Sometimes it is sometimes whether it is veterans or the active duty when they've been deployed, some of it is survival guilt, whatever went on there, and they come back and they don't want to share, or they don't want to, nobody can understand exactly. And there is a conflict right there, the personal values and the whatever was going on there, or and the trainings really of the military is to be a team. And so when one has gone and have come back and their teammates really were not, some of them didn't come back, there is that duty that they are carrying on with, and that because it is taking a lot of place in their mind, in their life, it creates some anxiety, creates some anger. I mean, when things happen or things happen around the house. And so, yes, there is those issues that the military population deal with more than the common civilian population because of what their job does, or what the training is, or what the mission that they normally do carry. Yes.
What barriers do they face when seeking mental health care?
The first thing that comes to mind is of course, is availability. A lot of times with veterans, when they're seeking assistance, a lot of times they feel like their primary go-to is the VA. So you have the VA hospital, which in this area, there's one in Durham. I believe there's one in Salisbury, and I think the next one closest is out near Winston-Salem. So the location of actual VA medical centers is not as available like when you see urgent cares or main hospitals. So having the availability of an actual upstanding VA facility is rare for veterans. So when you have limited access to it, you have a lot of people showing up. So then you have vast numbers of people trying to be seen. When you have those sort of things all mixed in, so you have low availability of facility and then a high influx of people coming in, you have people not getting seen as they should be, so they get put on waiting list, or they show up at the emergency room and there's 40, 50 people in there, and they start to wait and wait and wait, and they feel like, okay, this is not something I'm going to wait for, so they leave. So I think that one of the biggest obstacles they face is availability of care, especially if they're going through an actual VA facility and their options around this area.
That the stigma that they get on mental health within the military, they are trained to be strong and independent and courageous, but then with whether it is active duty or the veterans, that stigma of mental health, which have a stigma of maybe a weakness, it's also a barrier to them seeking for services. The other thing also I can add there is also the lack of expertise within the service provider sometimes, of the military life. So I think those are little barriers that really affect the unique need of mental health within the population of military and veterans.
I would like to add that, I want our veterans, whether they're active duty, retired, disabled, to know that, the VA is definitely there for you. Although the availability is limited, I want you to know that outpatient services that are not VA affiliated are definitely there for you. Here at MindPath Care, we have a huge veteran following. We have a huge veteran client base that, we may not be able to provide services through the VA system, but a lot of times TRICARE and insurance companies related to veterans and servicemen do pay for the services here at MindPath. So if you can't get into a VA facility, please, at least try to contact us and see what options we have available, whether it's for therapy. There's a lot of veteran group sessions that are out there where veterans can speak about things that, that they may have been experiencing in an area where people are peers and can understand that's not at the VA. We also have medication providers that, we can look at PTSD and try to treat that, as well as anxiety and depression. We have a great substance abuse counseling program that if there's, substance abuse, whether it's alcohol or other substances, we have those access here with MindPath as well. So even though we're not, VA affiliated, we still want to help you, and we still want to provide services and put you in that right direction.
There is help. You can feeling lonely or feeling less stressed or feeling sad or feeling you are anxious, negative thoughts, all those things that sometimes debilitate our productivity. Yes, there is help. And yes, we are here. MindPath is one of the largest mental health providers here in North Carolina. And yes, there is help. There is help. And without feeling you are stigmatized or you are feeling that you are the mental health is mental health, life happens. And so as life happens, there is people out there that here we are, that we can be able to work with you, whether it is with your families, whether it is the behaviors of your children, whether it is relationship issues. Yes, there is help.
What issues occur when dealing with change?
When they come back, they were used to give orders or to take orders, and then they come home. That is not what is happening within the home. The spouse, the kids are not taking the orders or deliberating the orders as he or she expects. And so that creates some issues within the families, which that's what we are talking about, seeking for help.
They're trained to do a certain job, and a lot of times that job is very meticulous, whether people's lives are involved. And when they come back home, whether they're in service or whether they're on leave status, after a deployment, it's hard for them to fit back into society where you don't act that way. In society, you try not to act impulsively. You try to think about things and about consequences of it, where in wartime situations, especially in conflict, you don't have time to actually think rational. You have to act impulse, and that's how they train you. Being a veteran myself, when you go through training, it's all about knowing it and acting, knowing and acting. You don't think about how this goes to here and this goes there. You just do what you need to do for that moment. So I think it is hard for them to really adjust back to, civilian life or interacting with the public.
How could social settings enhance their struggles?
I think currently right now, which I think we all can attest to, there is a lot of animosity with, just the general public, whether a person's view is one thing versus another. It definitely caused a lot of impulsive actions by society right now. And I think in that case, that can be a hindrance to military personnel, because one, they are trained to act to react quickly, so if they're in a social setting, and whether a person agrees with their military choice or not, they could approach a soldier and voice that opinion, and it could cause a reaction by the soldier, which could cause a reaction in place by the society member as well. And all this is just a huge sort of ball of energies, I would say, where it could be volatile in either direction. So I think in the current status of the way society is right now, soldiers are kind of weary to participate, I feel like, in a lot of social gatherings, because they don't want to, be ridiculed due to, being in the military, whether a person believes it's a good thing or not. That was their choice. And, whether you agree with the leadership at that time or not, you're still a soldier. It's just like your boss. If you work for a company, you don't have to agree with your boss, but you have to do what the boss, tells the company to do. Same thing for the military. Not all soldiers are in agreement with leadership, but that doesn't mean they still are not accountable for doing what their job is. So I think right now, with the polarizing opposites of society in that terms, soldiers are looked at, okay, well, why don't you stand out? Why don't you step out and say something against this or that? And soldiers can't, because you're held to the code of military justice, and you can't not outspeak to your superiors. And so soldiers are held at a different level that the general society public don't see. So I think that's causing a lot of issues currently.
Are there positive ways to cope with the pandemic?
Resiliency, that's huge with the soldiers' creed as well as with the military lifestyle. Is we would say in the military a lot, adapt and overcome. So you're faced with an issue, you don't really have time to really to wallow or to sit in the fact that something's not working. So you have to adapt and you have to come up with a new way to do it. So I think in that aspect of it, I think soldiers are more prepared for, environmental stressors like COVID-19 because, the CDC comes out and says you have to wear a face mask, so a soldier says, well, that's what we need to do for the moment. We'll wear this face mask and move on to the next thing. And a lot of, soldiers, the face mask is not as much of an issue because, we're used to wearing, when you're looking at the protective gear for soldiers, the actual, combat face mask, it's over the head and it has the canisters and all it. So just a simple face mask is not that big of a deal. But I think that's where you're seeing soldiers adapt a little better with the whole current environment, being able to say, okay, this is what we have to do for right now, and then when things change, we'll make those changes at that time.
Life happens, and as life happens to all of us, reaching out for help, thinking in a positive manner, being able to because you are the same person who, the same body that is, that you are a father or you are a mother or you are committed to the mission of the military. It is the same body. So being mindful of taking care of that body, which will be able to be productive, whether it's being a father, whether it's being a mother, whether it's being a sister, whether it's being a brother, being mindful of taking that body and taking care of oneself as a whole. That means taking care of your mental health, taking care of your emotional part of you, which is relaxing, thinking positively, reaching out to the professionals to be able to work with you or to process things with you, being able to write things, to do things that bring some energy or strength to oneself. Those are some of the things that one can be able to do to take care of themselves.
For more on this subject, visit us at abc11.com/mindpath.